All right. So we are going to bring this meeting to order, and I will start the meeting with the chairman's general announcement. The Board of Health is recording. Is anyone else recording?
No.
Okay. And this meeting is being held via Zoom pursuant to the Governor Baker's executive order.
March 12th.
March 12th. Thank you, Mary. I have too many emails and can't find the exact language. So pursuant to Governor Baker's executive order on March 12th, 2020. There we go. So going to grab my agenda here, and thank you, Tammy, for doing the agenda and for posting it and getting it posted and getting us here tonight. So we are going to start tonight with public comment. Is anyone here for public comment?
I am.
All right, we recognize Mary.
Well, my public comments are going to be very brief. I'm just bringing you greetings from the town manager's office in particular. I wanted to wish all of you a Happy New Year. I wanted to thank you once again for your service on this very vital board. I know that you've got some very contentious issues to deal with, which we wish we could just have the issues and not the contentiousness. However, life being what it is in 2022, we all know that. So I fully appreciate the stressors in your respective lives, and I just wanted you to know how much I personally and on behalf of the town want to say thank you for your service. You're performing an extremely vital role here for the well-being of the community. And I just think it's worth repeating over and over again. So thank you. And that's my public comment for tonight. I trust that your deliberation about whatever the issues are that come before you will be managed with sensitivity and thoughtfulness as they have been in the past. And I look forward and will support whatever decisions you come up with based on your expertise and experience. So thank you.
Thank you very much, Mary. We appreciate you. It is not on here. Do we need to do the minutes from the last meeting, Tammy?
We don't have the minutes.
Oh, okay.
This isn't like a special
the next meeting. Okay, perfect.
So
I just wanted to make sure I did not.
Hand up. I don't know if you're still taking public
Oh,
comment.
I'm so sorry. Yes, we will take public comment.
Sherry Brady, you can unmute.
Okay, thank you so much. First of all, I too, like Mary, I want to thank all of you. Doesn't look like I'm on video. I thought I punched video, but once again, I won't take up time with that. Oh, I know why. There we go. I had it covered. I want to thank all of you for the work that you've done. And like Mary, during these challenging times, there were just three things that I wanted to address. And first of all, I wanted to really say how fortunate I think that we are here in East Long Meadow to have all of you, but most especially Dr. Jobbins. And I say that because not everybody has someone like her on the board with her specialty knowledge in infection disease, and also her years of expertise and her frontline experience. And 2 weeks ago, I think at your last meeting, she spoke, I thought, very directly and eloquently from her experience of why she recommended the indoor mask mandate here for East Long Meadow. And I want to say that I really support her for all the reasons that she said. And she just has that experience and that frontline knowledge, everyday knowledge for her to make the decisions that she's recommending. The other thing that I wanted to mention is people talk about the businesses in town, and we all want the businesses in East Long Meadow to thrive. And since Long Meadow has put in their indoor mask mandate, I know a number of people that are going to Long Meadow to the CVS and Big Y in East Long Meadow, in Long Meadow, because they feel safer, not only for themselves, but for their children. And a lot of people are talking about how the Omicron is not as serious as Delta, but it's really affecting the children. All we have to do is read the paper and see the front lines, and Dr. Jobbins can tell us about, the high numbers of children at Bay State now with symptoms. And it may be milder for adults, but we know that children and adults do not do as well with upper respiratory infections. So we really need to protect the children who don't have an opportunity to be vaccinated, and we need to speak up for them. So I think that's pretty much what I wanted to say. And I just think at this point, we need to think more in terms of everybody's safety, as opposed to whether someone feels that a mask is an inconvenience or not. We need to think collectively, and we need to think about the safety and good health of everybody in East Long Meadow. So back to where I started, I support Dr. Jobbins' recommendation for the indoor mask mandate. Thank you.
Thank you, Sherry. Okay, is there anyone else for public comment?
I don't see anyone else.
All right, thank you. Okay, so the first thing on our agenda is the adoption of Governor Baker's December 21st, 2021 mask advisory. Do we have discussion about this that we want to do? Katie or Rebecca?
I
Anything?
think we discussed this pretty extensively at the last meeting that, I think this is the minimum of what we need to recommend. And that given what I'm seeing at the hospital and locally and statewide, that this is something that I would move that we vote on, and that we could actually, move to have this proposal, which we've posted, become, the minimum of what we are doing in the city as well.
Great. Is that a motion, Katie? You want to make
Yes,
a
it
motion?
is a motion to vote on the approval of the adoption of Governor Baker's advisory for masking in East Long Meadow.
Right, I will second that motion. And we will do a roll call vote. So Christine Johnston is aye, Dr. Katie Jobbins.
Aye.
And Rebecca Torsha.
Aye.
Okay. All right. Tammy, you're all set with the language and stuff on that?
Yeah, if you guys were good with that, it's pretty much just adopting what the governor said and putting it on our letterhead.
Great. So Tammy, I'm going to turn it over to you for the COVID-19 update to start.
Okay, well, all the information just got updated on the state's website today, because it's Thursday evening. So I pulled a few more important pieces of information off the website, but I don't have everything in front of me. But so for this last reporting period, which is from 12/19 to 1/01, we had 401 total cases, and our positivity rate is 16.31. The counties is 18.05. We had about 2,600 people take tests in that 14-day period. And of that 401 people, 218 of them were reported being vaccinated, and their average age was 36. So we're seeing it very young. A lot
And
of
we don't know if those were boosted, correct?
a good portion of them were boosted, but I don't have the numbers. It's when I can click on the category for vaccinated, and but then I'd have to go in by hand and count those 400 people.
And the reason why I'm asking is, so what we are seeing is those who are vaccinated and have not received the booster, we are no longer considering them vaccinated. And so if they are outside that 6-month, so in terms of treatment protocols and how we're treating patients, they are being treated as if they're unvaccinated. They are, vaccinated, so they have some level of protection. But the waxing immunity that we are seeing on the front line every day is that if you are outside that 6-month window and have not received your booster, your immunity drops dramatically and you'll be considered, yes, you are vaccinated, but you have not the same level as someone who has received the booster, which we know about Omicron and we have known from when the data started to be released.
And Katie, that's true for those folks outside that 6-month or 2-month, depending on which shot they got, right? So like
Yep.
my 6-year-old who is very recently vaccinated is obviously not eligible for a booster and so
Yeah.
would be considered fully vaccinated,
Yep.
right?
And so anyone who received Pfizer and Moderna, and you're in that 6-month window from when you received your initial dose. So you are fully vaccinated 5 weeks after your first dose, as long as you got your second dose. If you got Pfizer and if it's Moderna, it's 6 weeks because you have to wait 4 weeks for that. And then with Johnson & Johnson, you are fully vaccinated for 2 months. And is now recommended if you had the Johnson & Johnson to get a Pfizer or Moderna booster at the 2-month mark. And if you had Pfizer or Moderna in your first round, then you should be getting the Pfizer or Moderna as a booster shot. And that being said, anything is better than nothing, but we are still seeing, unfortunately, those who are outside that window are the ones who are testing positive, and they're having, thankfully, milder cases. What we are seeing, though, is of those we're testing, and we're testing 2,000 a day at Bay State, that of those who are positive, so 1 in 4 are testing positive, and of those who are being asked for admission who are COVID positive, it actually goes to 1 in 3. And those who are positive with COVID who are admitted, 3 out of 4 are unvaccinated. And that's true unvaccination, like they've received none. So the numbers are very, very skewed towards the unvaccinated population, and they are much younger. In the ICU currently, we have 27 people in the ICU and 283 people admitted.
Katie,
And
I'm
yeah.
sorry, real quick, what's the average age?
So the average
Ballpark.
age is younger. It's still in the 50s, because those who are admitted who are older
Mhm.
are those who are vaccinated, who may not have gotten their booster, who have multiple medical issues like diabetes, COPD, asthma, or even cancer. And then unfortunately, we are seeing, like was mentioned in the open comment, we are seeing children now test positive, and they are in the pediatric ICU. And those who are coming through, we're treating about 100 children a day with COVID in the pediatric ER, which was all over the news and in multiple news media outlets as well too. And unfortunately, like you said, Tammy, it's a numbers game. So we're seeing a much larger number of people test positive than we ever have since the pandemic began. So if you think about it, even though it's less severe, if you think about increasing the baseline from here to here, the volume of those who require hospitalization goes up proportionally to the severity. But if we're having, say, 2,000 positives a day instead of 1,000 positives a day, automatically that shifts those who require admission. So the curve shifts, and that means we have no volume. So what I need everyone to understand, and this just came out yesterday, there is no hospital availability in Massachusetts. And that means none. And so all the hospitals are over capacity. And what that means is we are rationing care because we just don't have the ability to get, to those people who are coming in. And what we are also seeing is everyone who is coming to the hospital for non-COVID illnesses are dramatically sicker because people have been delaying going until they're to that point where they're like, I need to go now. And so that alone is making the acuity of the patients we are seeing dramatically higher too. And based off of this data, I would say that we are actually in a state of emergency based off of the fact that I have National Guard at my hospital on every floor. And that alone is something we have never had. And that we have never in my career had a third of our beds filled with patients with the same diagnosis. And people who have been in practice much longer than I have also said the same thing. Never in their 40-year career have they seen this happen. So we have crossed over a different plateau, and it is not supposed to peak until the middle of January. So I have no idea what it's going to look like tomorrow, never mind next week. What other data did you get, Tammy?
Say it again.
What other data did you get?
Let's see, I pulled up some of the vaccine data. Numbers are slowly kind of creeping up. We're now at 68% fully vaccinated and 31% boosted. The numbers are going up for the younger group. We're now at 28% of the 5 through 11-year-olds, and then 65% for the 12 to 15 and 75% for the 16 to 19. Sorry. We're just getting everything, our ducks in a row to schedule a clinic at Birchland Park. So hopefully that'll be coming up soon. I know that everybody's kind of packed for the clinics, but so hopefully we'll get that soon. Although I'm feeling like maybe a clinic, this week or the next week is probably not the best if the numbers are going up and having people waiting in line. And I'm guessing we're not going to be getting one that quickly. Usually that takes about 2 or 3 weeks anyway. But it'd be good to have it in that space so that things can spread out a little bit more. So hopefully we'll be doing that soon. Also,
Tammy, can I ask a question about that?
Yeah.
What are you planning to do at that clinic? Is that boosters for those eligible? Is it, which may include the 12 to 15s at that point? Is
Everything.
it pediatric doses? Is it, what are you looking at?
Everything.
Okay.
Boosters first and seconds. Similar to what we did over at the senior center, but I think obviously in this case there'll be more first and much more first sec doses than at the senior center one. So that'll be good to get that going. We've had a hard time coordinating schedules for other clinics, so I just said let's just go straight to the schools instead. So get it done. We're also working with the town accountant to try to procure test kits because since we didn't receive any due to our poverty level not being or our income not being below poverty level, we didn't have it free like some of the other towns. So we're trying to procure tests through the states through Combis, which also may take some time as well. They had a webinar today. It could take 7 to 10 days to get that through. So we're doing that. Let's see. So a couple things came by this week from the CDC in regards to booster shots. So they've also now recommending Pfizer booster at 5 months post second dose. And that also for children 5 to 11 who are severely or modestly immunocompromised to receive an additional primary dose 28 days after their second shot. And then they also expanded booster eligibility for Pfizer for 12 to 17-year-olds. So we'll be able to do that age range at the clinic as well. And then
I want to make sure people understand. So the third dose that you mentioned, that's a different dose than a booster shot that applies for adults and for those who are young children. It's a full dose, again, not the lowered dose that you would get for a booster shot. And so those who are immunocompromised with active cancer, those are the people who qualify for that as well too. And there's a very good list on the CDC's website if people are wondering if they qualify for that as a third dose. It's different than the booster dose.
And apparently the new language, instead of saying that we're fully vaccinated, is that we're up to date with our vaccines. I thought that was a kind of a, when you see the special alerts that come in from the CDC and you click on them and you're, oh, okay.
My abbreviation for that is UTD.
UTD.
That's what I write. I'm like UTD.
We're UTD. That is mostly with the updates. This has been a really hectic week. The phone calls, being short-staffed has had its challenges this week. That is not all it. So also last week, the isolation and quarantine guidelines were updated. That's been my whole life. Why I should have started with that. My list. Need a bigger desk when I'm doing this. I've made myself a cheat sheet and sort of spread it around. It helps people a lot. We're kind of putting it into 3 sort of categories. One, how the isolation has changed if you test positive. So if you test positive, and that's for everybody regardless of vaccination status, from your onset of symptoms or your test date, you have to stay home for 5 days. If you don't have any symptoms, major symptoms, or symptoms are resolving after 5 days, you can leave your house on your 5th day while continuing to wear a mask for 5 days. If you have a fever, you continue to stay home until your fever resolves. And then there's sort of 2 areas that have changed for quarantine. So the first set of people for quarantining, this would be somebody who's exposed to somebody who is positive. So if you were boosted and you have completed the Pfizer or Moderna series within the last 6 months, or the J&J within the last 2 months, so that's your fresh vaccine series. Also, if you've tested positive still in the last 90 days, you don't necessarily need to quarantine, but you do need to wear a mask for 10 days around others. And then if possible, test on day 5, just to rule out if you have COVID. And the other group would be those whose Pfizer or Moderna series is over 6 months old, or their J&J is over 2 months old, or if they're vaccinated. If they are exposed to somebody and considered a close contact, you would have to stay home for 5 days. So your quarantine would be 5 days. And then on the 6th day, you could come out of quarantine, but you would have to wear a mask for the next 5 days, returning to normal activities on day 11. So that,
As long as you don't have symptoms. Like, that's the other thing, like I'm
Yeah.
having people say to me, well, I have symptoms now, can I come out? You cannot. If you develop symptoms, then your clock restarts. So it doesn't matter if it's on day 3 or day 6 or day 10. If you develop symptoms at any point, your clock starts at time 0 again, and you have to restart your quarantine.
Because many people I know continue to have symptoms past those 5 days. So that's, yeah, I'm glad you said that, mentioned that.
And it's recognizing that what we are seeing is if you continue to have symptoms and do not feel better, that means your viral load is higher. And so if someone is doing a self swab at home and it is negative and you have symptoms, you should repeat it in 3 days, 2 to 3 days on average, because if you look at the graphs, there's very specific graphs that are out there about how the antigen tests work. And if you then have, say, like a really, really faint line, and then you repeat it in 2 days and the line is darker, that means you have a higher viral load and you are more contagious at that point. Or if the first day your line is very, very dark and you repeat it in 2 days and the line is lighter, then that also means you're likely on the tail end of the viral load where your virus is shedding. There is a great epidemiologist that has a website about this that goes through this in detail. And there's a difference between that window. The antigen test window is very small, whereas the PCR test for positivity is much larger. So that's really important for people to recognize. And unfortunately, what we are seeing, because PCR is much more sensitive, which means if you are truly negative, you are likely negative from a PCR test. The turnaround time right now, because of the volume, regardless of where you're getting tested, is anywhere between 48 hours and almost 4 days. So you're likely still going to be in your quarantine. And so what I really encourage people to recognize is, please don't be frustrated. This is happening across the entire state, but follow the quarantine. It is in place because virologists who are specialists in how viruses spread now know you're likely infective or contagious 1 to 2 days before you develop any symptoms, and then 3 days, which is why people are asking, well, why is the quarantine shortened? It is shortened because we now understand this new virus variant, and that it's super, super, super contagious, meaning you can get it very quickly with less exposure, but it also means that the duration of how long you're infective has shortened as well too because of that,
Mhm.
which is what we see as viruses progress and mutate. mRNA viruses mutate all of the time. That is part of how they work.
Katie, do you know the name of the epidemiologist or the link or the website, if you don't mind?
Yeah,
or-
so her blog, it's My Local Epidemiologist is what it's called. Let me see if I can find her website for you
It's
specifically.
great.
Yeah,
Thank you.
and she is amazing. Her name is Dr. Caitlin Jetelina, Jetelina. She has a master's in public health and a PhD in epidemiology and biostats.
Is it
and-
Caitlin with a K or a C?
Katelyn. And her website is called the your local epidemiologist.substack.com.
Great.
She
thank
also
you.
posts on social media.
Yes,
So
she has a
if you
very
follow
large
her like
social
on
media.
Facebook or Instagram, she will post links to her. I follow the same one.
Oh, okay.
Excellent.
Thank you.
Yeah.
And
That's
I
great, thank
find
you.
this to be really helpful for not only higher level thinking, but also for someone who does not understand epidemiology at all. She puts it in like regular human being language, which the data is changing regularly, and she posts updates frequently. So if
Great.
someone wants to learn more about this, it's a great place to start.
Wonderful. Thank you.
So Tammy, I know you sent me an email about Robert's rules. I read it, I reached out, and I know the last time we did a mask mandate, we were told we did it incorrectly because it wasn't deemed an emergency by the Attorney General's office. And seeing as Mary is here and she is a retired lawyer, I was wondering if she might be able to give us some information about how we determine when an emergency really happens in regards to Robert's rules and when we can actually make something outside that scope happen.
Well, since you asked, I've spoken with Tammy about this issue a couple of times this week, anticipating that your concern in particular, although I'm sure the other board members share it, would be heightened based on your experience. I am a retired lawyer, but I cannot in good faith counsel the town. And so I'm deferring to the town's legal counsel on matters such as this. And his name is Jesse Tim. And I know Tammy has talked with him as well. And he's suggested that the Board of Health could issue a regulation, which would require a 14-day notice and a public hearing and several other procedural steps. The issue of emergency, I think, is a little bit different. I told Tammy I declared an emergency for the town of East Long Meadow in March of 2020, and I've not rescinded that declaration. However, it came on the heels of Governor Baker's declaration of a statewide emergency. And he, in fact, has rescinded his emergency status in Massachusetts. So we're kind of straddling the issue. I want to talk to our council again and determine if our local declaration of independence emergency is sufficient for your board to proceed in the vein that I think you want to, or you're inclined to. But the whole issue of the agenda and the open meeting law is what gave rise to a complaint against the town that has, as you know, has been resolved. And I don't want to be worried about any particular individual objecting to this or be intimidated by the prospect of further legal action or attempts to intercede or intervene with what you as a board believe the proper action is. So that's a long answer to a short question, but until I get a definitive answer from Jesse Belcher Tim, I would have to advise you that I don't think we can proceed based on my individual declaration of emergency. And Jesse did tell me, and I'm sure he repeated it to Tammy, that the Attorney General's office also has not declared this an emergency, which really it strains credulity in my view, but, maybe the next few days will change things. I don't know. So I'm
And
sorry, I
that-
can't.
No,
give
that
you
was
a
it.
more defined
That was what I
answer.
was referring to, because I knew we had declared a state of emergency in East Long Meadow, so I wasn't sure if that qualified, because Tammy reached out to Jesse, which I really appreciate, and Jesse wrote us a very eloquent response about what that looks like. So that's why I was questioning where we were. And obviously Governor Baker did call in the National Guard, but did not declare a state of emergency again. And obviously we will see what plays out over the next few weeks. Springfield, Westfield, Longmeadow, Agawam all have mandatory masks. I think Northampton even does too. So many of our, sister or brother cities already have those in place. And I know we said that we could talk about it today and then plan a date, just like we did for this meeting, to say we'd like to have a meeting to have a discussion about implementing a mask mandate, so we could actually vote on that as well too.
Yeah.
And we have to
If
post
we-
it in the newspaper, correct?
Well, if you were going to enact a regulation, yes, but for agenda purposes, you have to specifically indicate on the agenda that there will be discussion of imposition of a mask mandate. That was the failure, quote unquote, last time. So,
So if,
And that's,
if
I want
there's
to make
no
sure we're
snow day,
following the rules.
if there's no snow day tomorrow, I can post a meeting for Tuesday. If you
But
guys
it's
want.
what is the newspaper for East Long Meadow? Is it considered the Reminder, or is it our website?
well, we would put it in both, but the legal notice would go in the reminder. Yes.
Okay. When does the Reminder come out?
I think it's published every I think it's issued every Thursday. And I think anything that is intended to be in that Thursday edition has to be in by the preceding Tuesday. So you might have if your meeting would be Tuesday night, you wouldn't have time necessarily to get anything in the paper that week. But we can talk about it tomorrow, Tammy, if you're in and I'm in, and we'll figure out what we're gonna do.
I obviously did not go to law school or any, I know some legal words from the medical realm. Like I tried to find people who are Robert's Rules expert to teach me so I could learn, which is why I'm asking questions. I want to make sure we're following the right rules to do this the correct way. So not only medically and
Right.
legally, we are doing things by the letter of the law.
Well, interestingly enough, the Attorney General is going to be doing Zoom trainings on the open meeting law that I've asked my assistant to distribute that information to all of our board and commission members so that you can take advantage of that. There'll be more than one webinar, but I do think it's vital information to assist everybody in the operation of what we're doing here.
Can they record those? I have a hard time attending them just because, my schedule's a little wacky.
It probably
do they
would be.
record 'em?
I don't know if.
I'll look into that for you guys, see if they are recorded.
Yeah.
Yeah.
Thank you. That would be very helpful.
It would be very helpful. And thank you both, Katie and Mary, for all your hard work, and Tammy and Jesse as well, who's obviously not here, but we appreciate all the hard work and making sure we do this right. And personally, I just want to say, like every place I've been, I would say the vast majority of people are already masking. And so I just want to shout out to the town, like for all the folks who are out there who are doing this already. I was in a business last night. The staff was all masked. I actually thanked them for it. I said, I appreciate this based upon their clientele. And so just a huge thank you to the vast majority. Anywhere between 75 and 90% of people that I see out in public already doing what we hope they would be doing. So just
And
throwing that out
I've
there for
asked
all the
that
folks.
everyone in town hall and all municipal buildings mask up upon entry, and all our employees are doing so. And as you say, Chris, most visitors to the building I have observed are wearing masks. So I issued it as a request as opposed to an order. And so far, there's been no objections, but tomorrow's another day.
And I don't know if anyone else saw, the CDC did come out with a graph that shows the effectiveness of masks based off of the newest evidence that has come out as well too. And I highly encourage people, if they haven't seen that, to look this up as well too. But what it shows is, although cloth masks are better than nothing, surgical, like the blue 3-ply or whatever color one you get, is obviously the next step up, which is what I would recommend at minimum for anyone. And that KN95s or KN94s are obviously the next step up, and then N95s. And I would like to tell people that it's actually much more comfortable to be in a KN95 than it actually is for some of the cloth masks, because you don't have to like reposition it all the time. They actually fit in a better way. They look like a triangle. And that alone will make a huge difference. And if you think about, there's been many funny memes about like the peeing of the pants, if people are wearing pants, or if you're wearing a mask, and making that analogy, but it's a really simple way to think about it. It's moisture. And so if you stop the spread of moisture from your face, and the person also is wearing a mask, it stops that spread. And ultimately what it does is, you know, if it gets wet because you're sneezing or coughing inside, that's when you take it off and get a new one. It's not 100% all the time, every day you can wear the same mask. You should be changing them. You should be rotating them. And if you do sneeze on the inside, change it and get a new one. If someone coughs on the outside because they're not wearing a mask, change it and get a new one. And I wonder if, and I don't know if this exists, I know some areas are having grants that they're applying for to get masks as well too. That might be another opportunity. Just if we're going to give out people, you know, a testing kit, maybe we say, here's a box of, you know, surgical masks as well too. And I don't know if that's something we could potentially look into, Tammy.
I could, but there's no shortage of surgical masks available, both on hand and through Hampden County and through the Western Regional Homeland Security Council. There's supplies that at some point people were turning them away because no one had room for it.
And I just think, you know, if whatever we can do to help people achieve that goal, then, you know, I'm literally, I'll throw it at people. If they want them, take them.
Yeah.
So what I can do tomorrow, as long as town hall isn't closed, I'll put a tentative agenda together. And if we can have a vote on Tuesday, we can have a vote on Tuesday. If we can't, then we'll scrap it. I mean, at least that way we have something on the calendar. And that's okay, right, Mary? Like, that's, yeah, if you change your mind, we change our mind.
Absolutely.
Yeah.
Do we need to touch base with Jesse to make sure we're doing it correctly, Mary, just to kind of, and Tammy, just to make sure we've crossed all of the T's and dotted all the I's, and then see if that's enough time?
I think that's wise.
Can I add a point for discussion tonight? And one of the things that people asked us a lot, the criteria for removing the mandate, right, is I think something we need to really talk about before we draft the language. If we do have that meeting next week, right, is it a date? I know Springfield went with a date, right, up to a certain date. Is there data that we would be looking at when the positivity rate drops below a certain number? Is, you know, so I just want to put that out there so that we can actually come to at least have a discussion about that, you know, and that can change, right? We can say date and meet to rescind it early, or, you know, meet to extend it. It doesn't have to be a one and done, but certainly having something out there where people know it's not forever, right? We are not asking folks to do this forever, although there will be folks who want to mask up in flu season for the rest of time. And if you want to do that, go for it. So just thoughts out there about what we would like to do. I know Springfield went with March 1st as the end of theirs. I haven't looked at what the other towns have done.
Based off of what we've seen in other countries with this variant, I would recommend a 6 to 8 week window also, given where we are. So we haven't even reached the peak yet, and we are already 3 weeks in, almost 4. So I would suggest either, the same March 1st, or if we look at data in terms of positivity rate and infectivity, normally between 2 and 3% is where we can see that, especially where we are now at 16 to 18%. Once the numbers are below 2% is normally when you see that community spread drop dramatically. And, obviously from that standpoint is where I think that's where we were last time. We went above 4 when we implemented it, and then we took it away when we were around 2 the last time, because I went back and looked at the data, what the dates. But I think, reassessing on March 1st to say, hey, we need to extend this, or we, like you said, if we all of a sudden the surge drops dramatically and our numbers come way back down, then we can kind of think about lifting it earlier.
Yeah, that makes a lot of sense. Right. If we see that cliff starting to come down, then we can schedule something to say, we might not be at that 2 to 3% yet, but we're headed there. Right. And some of that is going to happen when, unfortunately, so many people get this, that it literally is just going to go through. And what we're trying to do, right, is help out Katie and all the other folks.
The other thing too is and I don't know if many people are aware of this, I've had so many people say to me, well, I already had COVID, I can't get it again. That's not true anymore. And so I am seeing people reinfected much, much sicker. They didn't get the vaccine because they already had COVID. And so I highly encourage people, if you've already had COVID and you are unvaccinated, please get it now.
And I've seen it in young adults who had it a year ago, or even longer than that, who are vaccinated, who are having it again.
Yes,
Luckily.
same thing. Mhm.
Yep.
Yep.
And that it's crazy too, when someone's like, I got the vaccine, why am I getting it again? And it's, they didn't get the booster, or they just got the booster like 2 days before they develop symptom onset. And the booster takes, a week or 2 to really kind of reaccumulate those antibodies in your body.
Mhm. And we're also doing a lot of PCR testing, right? So we're seeing a ton of asymptomatic infections among young adults. We're just very fortunate. Our turnaround time is up significantly, but we have the access to the testing. And most of the folks I talked to yesterday had either no symptoms or so mild symptoms. They were all vaccinated.
Mhm.
And if anyone has questions about this, we are happy to help you navigate this and understand it. That's what our job is as public health officials. Call your primary care physician or practitioner. Speak with someone who has a medical background. Please don't trust social media influencers. I'm seeing, unfortunately, many, many people who have not, and then all of a sudden they're in my hospital saying, I wish I had talked to you. And that's, I think, what people need to understand, that we have all on this call collectively had a ton of education around public health, and we need to have that be what people are understanding. This is not political. This is literally a medical crisis. I have never seen anything like this in my career. That is a fact. It's not even an opinion. And I hope to never, ever see anything like this again. I mean, a third of Bay State. The entire hospital is 716 beds. We have 238 beds for people who have COVID in it. No history of medicine has there ever been a disease that has been a third of those admitted to a hospital have a disease, the same disease. I mean, that's I get goosebumps every time I think about it.
Mm-hmm. And not to throw Tammy and your staff under the bus, but if you have questions about quarantine or things like that, right, that is why the health department exists, although please don't call every single day. But we're trying, right? And we have the resources, to answer some of those questions. And also, I know, Rebecca, the school nurses, right, are getting bombarded with questions,
Yes,
but they are
yes.
another resource. Like if you're a parent, have a child in the school system, like that's
Call
what
your
they're there
school
for.
nurse. Yeah. The school
And the
nurses
school
are
nurses are
wearing many
amazing.
hats. They are. In fact, they are kind of a catch-all. And I know myself when I did it, you almost become their doctor as well.
Mhm.
So, and depending on what community they're in, there's a lot of education that needs to be done. We did a lot of educating as school nurses. So kudos to them. Mhm.
And I understand that there's a mental health crisis going on with children and adults too, as a result of, the pandemic. I don't want to ignore that either. So if people are not feeling well mentally, there are
Mhm.
crisis numbers as well that exist if you need help. So please, please, please also reach out if you don't know who to call. We can even post them on like our social media, the national suicide number, or, we have state-run emergency crisis numbers for those who need mental health as well too, which I know we're seeing younger and younger,
Yes.
and in people who've never had mental illness before. And it is not something to be ashamed of. We all are feeling very uncomfortable.
Mhm.
Mhm.
Tammy, if we do think about posting some of those on the social media, can you make sure that we include the inclusive ones too? The Trevor Project, for example, which is mental health crisis services for folks who are in the LGBTQ community. There are specific resources for folks who identify as people of color that can connect them with providers who may be of their same demographics, right? So I just want to make sure that we have not just the National Suicide Prevention Lifeline,
Mhm.
but and the state resources, but all the ones that are specific to particular folks out there, making sure that everybody feels comfortable accessing those services.
Do that.
Also, I'm sorry, I just realized this too. We're having a dramatic shortage of blood. So I was wondering if we could potentially, for discussion, talk about maybe setting up a blood drive. It's so bad, we're rationing blood across the entire country. So if you are able to donate blood, please consider doing that. And maybe we could set up a blood drive, in the town, or do one, more frequently. It's another crisis that's going on. And if you have the ability to donate, we would be greatly appreciative.
Katie, if you have resources, I know that a lot of places aren't accepting, right? And so that's been part of the issue. And so if you have resources you could share about how to do that, because I know a lot of folks who have traditionally donated blood, they don't have the means to do that right now because they don't have the same place that they normally went.
Yeah, and so the Red Cross has an updated list of where you can donate, and that's normally where I've been directing people because they are the go-to for that. Also, I know all of the health systems in the area have been trying to set up mobile, pop-up blood drives, and trying, like you said, trying to find appointments at your regular donation place isn't the same right now. Again, staff shortages because of people having illness or just having different jobs and things like that. So I always recommend going to the Red Cross website, and then you can look and call the place that is closest or easiest for you to access.
Chris, if I can make one final comment, I'm going to
Please.
recommend at the town council meeting on Tuesday that people tune in and watch the recording of this meeting, because the information that you've been disseminating to the public and certainly to myself personally is really remarkable. And it's a true learning experience. And there's just so much information overload. It's nice and concise and thorough. And I think it would be a great benefit to the community if they would tune into LCAT and on the YouTube version. So Jamie, if you're listening, let's get this meeting uploaded as soon as possible.
Will do.
Okay. Because I think it would be a big asset to the community to have that resource available.
Okay, so it sounds like in terms of next steps, Tammy, and Mary, you're going to reach out to Jesse, figure out what we need to do, what's going on, how we can appropriately move forward in all the guidance. We talked about potentially a March 1st, at least reevaluation. That's at least that's what I'm hearing in terms of timeline. Also recognizing that that's sort of in line with a lot of the communities around us, so that we're keeping up with other folks. I'm assuming DC is going to bring out guidance because they haven't changed the January 15th thing as far as I understand, but I anticipate that will be coming next week because if not, that's a huge issue. So hopefully we'll keep our eye on DC there.
Yeah.
But yeah, we'll take it. Whatever the next steps are, please let us know.
I will keep everybody posted as soon as all that information rolls out too.
We're saying potentially Tuesday night at 6 PM. I can literally do any night next week at 6 PM if we have to move it back. I would even do Friday night if we needed to. If that's what it means about posting it on Thursday and having the meeting Friday.
The only time I can't do is 7 on Tuesday, but I can do 6 if we can be done by 7. I don't know if that will be possible if we have public comment. But if it's a one and done meeting where we don't need to discuss a lot of other things, then I can, as I'm done by 7.
6
I can
works for
also
me as
do-
well.
Any other night.
Well, let's see what the weather brings tomorrow. And I'll post it for then. I'll just float by an agenda by you guys first. And then we'll just see how the snow falls.
And folks, be safe out there because you don't need to be getting in a car accident tomorrow.
I know, I'm driving to the hospital at 6:30 in the morning, so fingers crossed.
Ooh, be careful.
Thank you.
This
And
be
all
a
of you be
slippery
careful too.
commute. Yeah. Thank you.
All right, so we need a motion to adjourn the meeting.
I'll motion to it. Yeah, good, Rebecca.
I'm gonna adjourn, yeah. Motion to adjourn.
I second.
All right, so roll call vote. Christine Johnston, aye. Katie Jobbins,
Aye.
Rebecca Torshaw.
Aye.
All right, thank you, everyone.
Everyone
Thanks,
stay safe. Take
everybody.
care.
Be well.
Thank you,
Have a
Mary.
good evening. Bye.
Be good.